She thought she was just tired. That was the word she used when her daughter called that evening to check in. Tired. A little headache. Nothing worth making a fuss about. She had been tired before. She had had headaches before. She went to bed early, the way tired people do, expecting to wake up feeling better. She did not wake up feeling better. She woke up unable to speak. Her right arm would not move the way she told it to. Her face had changed overnight in a way that terrified her daughter when she walked through the door. And the doctors in the emergency room said something that the family kept turning over in their minds for months afterward. They said the signs had almost certainly been there the day before. The day she called herself tired. The day she dismissed the headache. The day the window to prevent what happened was still open, and nobody walked through it. This is not a rare story. It is one of the most common tragedies in stroke medicine, and it repeats itself tens of thousands of times every year across this country alone. Not because people are careless. Not because they are uninformed about strokes in the general sense. Most people know the word stroke. Most people have some version of the FAST acronym in the back of their mind. Face drooping, arm weakness, speech difficulty, time to call. But what most people do not know, what almost nobody tells them in clear and specific terms, is that a stroke frequently telegraphs itself in the 24 hours before it strikes with symptoms that are easy to dismiss, easy to explain away, and easy to sleep through as if they are nothing. And those dismissible symptoms are the window, the only window, the one that, if recognized and acted on, can prevent a catastrophic event from occurring at all. That window is what this video is about. And if this kind of specific, potentially life-saving information is what you believe more people should have access to, hit like and subscribe right now. Dr. Victor Lang created this channel for exactly this purpose, to make the critical medical knowledge that saves lives available to the people who need it most, in language that is clear enough to actually be used in the moment it matters. Let us start with the biology, because understanding what is happening inside the brain and its blood vessels in the hours before a stroke changes how you interpret the warning signs. Most strokes, roughly 85% of them, are ischemic strokes. This means they are caused by a blockage, a clot, or a piece of arterial plaque that stops blood flow to a region of the brain. And in many cases, this blockage does not happen suddenly and completely all at once. It is often preceded by a partial blockage, or a brief complete blockage that temporarily resolves on its own, leaving the brain briefly oxygen deprived before circulation is restored. These brief episodes are called Transient Ischemic Attacks, or TIAs, and the medical community sometimes refers to them as mini-strokes. But the word mini is dangerously misleading, because what a TIA actually is a major stroke that interrupted itself before it caused permanent damage. And it is one of the most powerful warning signals the human body can produce, because research consistently shows that somewhere between 10 and 15% of people who experience a TIA will have a full stroke within 3 months, and that roughly half of those strokes occur within 48 hours of the TIA. The body sent a warning, it resolved, and then it delivered on the warning it gave. The reason most TIAs are not recognized is not that their symptoms are subtle. It is that their symptoms are brief and resolve completely. A person's vision goes blurry, or they lose sight in one eye for 2 or 3 minutes, and then their vision comes back to normal. A person's words come out wrong, or they cannot find the word they want for 60 seconds, and then speech returns to normal. One side of the face droops slightly, or an arm feels weak for a few minutes, and then everything feels fine again. When a symptom resolves completely, the human brain's almost universal instinct is to retroactively minimize it. It passed. It was probably nothing. Maybe I was just tired, or the light was strange, or I slept on that arm wrong. The return to normal feels like proof that nothing serious happened. It is actually proof that something extremely serious happened, and the window to act is still open. This is one of the most dangerous gaps in public health knowledge about stroke, and it is the gap that costs the most lives and the most function. Because a person who calls emergency services immediately when their vision goes suddenly blank in one eye and then comes back is a person who can arrive at a hospital while the window for intervention is fully open. A person who waits, who explains the symptom away, who goes to bed and hopes for the best, is a person who may wake up in a very different world. So let us talk specifically about what the 24 hours before a stroke can look like, because this is the heart of everything. The first category of warning signs involves sudden and unusual neurological symptoms that are brief, resolve on their own, and are then minimized or forgotten. sudden confusion that comes and clears, where a person briefly cannot follow a conversation or does not know where they are, and then they are fine again. Sudden difficulty finding words or saying the wrong word without intending to, for a short period that passes. Sudden vision changes in one or both eyes, blurring, darkening, double vision, or a curtain-like loss of vision in one eye that comes and goes. Sudden numbness or tingling on one side of the face, one arm, or one leg that resolves within minutes. Sudden weakness in one hand that makes them drop something they were holding, and then the strength returns. Each of these episodes, occurring in the 24 hours before a major stroke, represents a TIA. Each one is the body's most urgent warning system activating, and each one that passes without prompt medical evaluation is an opportunity that the window quietly closes around. The second category of warning signs is less widely known and more insidious, because these symptoms do not look like the stroke symptoms people have been taught to recognize. A sudden, severe headache that comes on rapidly, often described as the worst headache of my life, or a headache that feels qualitatively different from any headache the person has experienced before, is a recognized pre-stroke warning, particularly for hemorrhagic strokes caused by a ruptured blood vessel. This headache often comes without the nausea, light sensitivity, and gradual buildup of a migraine. It arrives fast and hard, and it may be accompanied by neck stiffness, which indicates blood irritating the membranes surrounding the brain. A person who calls this headache a bad migraine and takes pain medication and lies down has not done something unreasonable. They have done exactly what most people would do, but they have also missed the signal. And depending on what is happening in their brain vasculature at that moment, lying down and waiting it out rather than seeking immediate evaluation may be the most consequential decision of their life. Sudden and unexplained dizziness is another warning in this category, particularly when it arrives with a loss of balance or coordination that is unusual for that person. The cerebellum, the region of the brain that governs balance and fine motor coordination, sits at the back of the head and is served by blood vessels that are among those most commonly involved in posterior circulation strokes. When blood flow to the cerebellum is briefly interrupted, the symptoms are dizziness, unsteadiness, difficulty walking a straight line, and sometimes a sudden inability to coordinate movements that should be automatic. This type of dizziness is qualitatively different from the dizziness of standing up too fast or the dizziness of being overtired. It arrives suddenly, without positional trigger, and it may be accompanied by nausea and a sense that the room is moving rather than just feeling lightheaded. In the context of someone over 50 with risk factors for stroke, sudden unexplained dizziness with balance disturbance should be treated as a medical emergency until proven otherwise. Extreme and unusual fatigue is a third warning that is almost never discussed in the context of pre-stroke presentation, and it is perhaps the most frequently dismissed symptom on this entire list because it is so easily explained by other causes. Research on stroke survivors who were interviewed about the 24 hours before their event consistently documents a striking prevalence of profound, unusual fatigue, not the fatigue of a busy day or a bad night of sleep, a fatigue that feels different, a heaviness that arrives without obvious cause, that makes basic tasks feel effortful, that prompts comments to family members about feeling strange or not themselves. This fatigue is the body under profound vascular stress, the brain struggling against compromised blood flow, the energy depletion of a system working desperately hard to maintain function against a failing supply. It is the symptom that prompted the woman in the opening of this video to call herself tired. It is the symptom that, if recognized as what it actually was, might have sent her to an emergency room instead of to bed. Before we go further, it is worth pausing to name the elephant in the room that makes all of these warning signs so difficult to act on in the real world. Every one of them can be explained away. Every one of them has a benign interpretation that is far more comfortable to accept than the alternative. A brief word-finding difficulty can be attributed to stress or sleep deprivation. A sudden visual disturbance can be chalked up to migraine aura or staring at a screen too long. Unusual dizziness can be attributed to dehydration or low blood pressure. Sudden fatigue can be explained by any number of things in any given person's life. The human mind is extraordinarily skilled at finding the most comfortable explanation for a symptom, particularly when the less comfortable explanation carries the emotional weight that a potential stroke carries. Accepting that you might be experiencing a stroke warning means accepting the fear, the medical system, the disruption, the vulnerability, and the mind, in the moment, does not want to do that. This is why knowing this information intellectually before the moment arrives is so important, Because in the moment, the instinct toward minimization will be powerful. The only thing that can compete with that instinct is a prior decision, made in a calm moment, that certain symptom combinations will be treated as emergencies regardless of how they feel and regardless of how much the mind wants to explain them away. If you make that decision now, before you or someone you love needs it, you have already changed the outcome of a potential event that has not happened yet. The specific combination of symptoms that most consistently preceded a major stroke in the research on TIA presentation and stroke timing is this: any sudden neurological symptom, however brief, involving vision, speech, sensation, or movement on one side of the body, occurring in a person over 50 or in a person with cardiovascular risk factors, is a medical emergency until a physician determines otherwise. Full stop. Not a reason to wait and see, not a reason to sleep it off, a reason to call emergency services immediately, because the treatment window for ischemic stroke is measured in hours, and the difference between arriving in that window and arriving outside of it is often the difference between full recovery and permanent neurological deficit. The clot-dissolving medication used to treat ischemic stroke, called TPA, is only effective when given within a specific time window after symptoms begin. In most protocols, this window is 3 to 4.5 hours. Mechanical thrombectomy, the procedure where interventional specialists physically remove the clot from the blocked vessel, has a longer window, sometimes up to 24 hours, but it depends on rapid evaluation and imaging to determine eligibility. Every minute of delay, from the moment symptoms begin to the moment treatment begins, represents brain cells dying at a rate that neurologists describe as equivalent to aging the brain 3.5 years per hour of untreated stroke. This is where the phrase "time is brain" comes from, and this is why the 24 hours before a stroke are not just medically significant. They are the difference between a story that ends in recovery and a story that ends in a wheelchair or in a care facility or at a funeral. There is also a category of people who are at the highest risk of missing these warning signs and acting on them too late, and this category deserves to be named directly. They are the people who have been trained their entire lives to push through discomfort, to not make a fuss, to wait and see if something resolves before involving the medical system. They are often older adults who have seen worse and do not want to be dramatic. They are often caregivers themselves, who are so practiced at attending to other people's needs that attending to their own warning signals feels unfamiliar or indulgent. They are often people who have had benign symptoms resolve before and have learned from that experience to wait. Knowing this tendency in yourself or in the people you love is protective information, because the decision to wait and see is the decision that costs the most in the stroke context, and it is most commonly made by exactly the people who have the most to lose from it. What can you do starting right now to change the outcome of a potential event that may or may not ever come? First, make the internal decision we discussed. Name the symptoms that will not be waited out, not by you, not by someone in your household. Sudden one-sided numbness, weakness, or drooping. Sudden confusion or speech difficulty. Sudden vision change. Sudden severe headache unlike previous headaches. Sudden loss of balance or coordination. These get emergency services called immediately, without the wait-and-see delay. Second, make sure the people closest to you know these warning signs and know the same rule. Strokes frequently impair the very cognitive and communication functions that a person would use to recognize and report their own symptoms. A spouse, a sibling, a neighbor, a colleague who knows what to look for and knows not to wait, can save a life in the moment when the person having the stroke cannot save their own. Third, if you or someone close to you has already experienced any of the brief symptoms we discussed, a few minutes of vision loss, a short episode of word-finding difficulty, a brief weakness that resolved, please seek medical evaluation now, not when it is more convenient, not after the weekend. The post-TIA window is when intervention most dramatically changes outcomes. The story does not have to end the way the story at the beginning of this video ended. That is the truth that matters most in everything we have covered today. The warning exists. The window exists. The knowledge exists. What changes whether that knowledge saves a life is whether it lives somewhere accessible enough to be acted on in the moment when the mind is tempted to explain away the most urgent signal the body can send. Share this video with someone you love today. Not next week. Not when you remember. Today. Because the person who needs this information most is not reading a medical journal. They are living their ordinary life, and the signs that could change everything may arrive without announcement at any moment. And if this conversation touched something real for you, tell me in the comments. Tell me if you or someone you know had a warning before a stroke that was missed. Tell me if something from this video changed the way you will respond to a symptom in the future. Your words in that comment section may be exactly what moves someone else to make the call that saves everything. A stroke does not always arrive all at once. Sometimes it knocks first. The only question is whether you are prepared to answer the door.